Luton and Dunstable Hospital, like so many others across the country, in the front line of the fight against coronavirus. This hospital has already seen so much tragedy, with over 70 deaths, and now it's lost one of its own. Channel 4 News has learned that a 28-year-old nurse who had tested positive for COVID-19 died here on Sunday. A few days earlier, she had undergone an emergency caesarean and given birth to a daughter. We understand the baby is alive and being cared for. Today, the hospital confirmed that the nurse, Mary Agyeiwaa Agyapong, had worked there for 5 years, praising her as a highly valued and loved member of the team. She was admitted to the hospital on the 7th of April and had her baby delivered by caesarean section soon after. We have been told her health then deteriorated and she died 5 days later. She had no underlying health conditions and is the first member of their staff to die from COVID-19. Her baby was initially cared for in the neonatal intensive care unit at the same hospital. We have been told that the baby and Mary's husband, who is apparently self-isolating, have been tested for COVID-19. Channel 4 News has confirmed that Mary was working at the hospital until at least the 12th of March, but possibly some days after. She worked on Ward 12, which is now a COVID virus ward. The hospital claims it did not have COVID patients at the time she worked there. She was working well into her 3rd trimester of pregnancy, and there will be questions over whether she should still have been at the hospital and the advice given to NHS staff there.
So the Royal College of Obstetricians and Gynecologists state that there is a distinction between women who are before 28 weeks gestation and after 28 weeks gestation. And they say that after 28 weeks gestation, women should not be working or should be working in safe environments. But before 28 weeks gestation, they don't make such strict claims. This guidance, I feel, has created confusion around what their legal rights are. And now the guidance needs to clearly state that all pregnant women, no matter what gestation, should not be working in patient-facing roles, in roles where they cannot stay 2 meters distance from other people, and they must be at home on full pay.
The hospital said they had followed official guidance regarding pregnant staff, including moving pregnant women away from all public roles. At least 45 NHS staff, many of them nurses, have now died from the virus. There are questions over the circumstances in which Mary may have become infected. Sources at the hospital have told Channel 4 News there have been regular shortages of gowns and widespread rationing of masks, including the time when Mary was working there. According to one source, this has led to widespread discontent among staff who fear they may have been left exposed to the virus. The hospital said they had not experienced any significant shortages. But the death of yet another NHS worker in the most tragic of circumstances again casts a spotlight on the government's management of this crisis and those risking all on the front lines.
Inigo Gilmore reporting there, and the hospital have told us she wasn't treating anyone who was confirmed or suspected of having COVID-19. Now, the Health Secretary has announced a raft of policies aimed at helping people in care homes in England, including testing for all care home residents and staff exhibiting symptoms. It comes as coronavirus races through a group of the most vulnerable in society. The Welsh Government says it's testing symptomatic residents and staff in care homes, while in Scotland, First Minister Nicola Sturgeon revealed that a quarter of COVID-19 deaths had occurred in care homes. Here's our chief correspondent, Alex Thompson.
Another day, another multiple death incident at a British care home. 8 residents at the Green Hayes home on Merseyside have died with suspected coronavirus. Multiple deaths also reported in Cornwall yesterday at a care home in what's described as a continuing incident. For those residents, the overnight government U-turn comes too late, of course.
All care home residents who are discharged from hospital will be tested before being admitted into their care home. We'll test all symptomatic care home residents, and as I announced last Friday, we've introduced testing for all social care colleagues and members of their households who need a test.
I'm sure you'll all accept what is obvious. You've all been late very late in dealing with the crucial issues of care home staff and care home residents. Was that because, frankly, you wanted to prioritise the lives of younger people in hospitals at the NHS sharp end?
No, Alex, neither of those things is the case, and very obviously not. The truth is that, as I said in my opening comments, that we first put out guidance to social care in February, and we've repeatedly updated that guidance according to the circumstances, according to the progress of the disease, the increasing prevalence of the disease in the community.
The trouble is, some of that government guidance back in February now looks bizarre in the light of what has happened. On February the 24th, Public Health England issued guidance for care homes stating staff don't need to wear masks and those receiving care are at very low risk. It remains very unlikely that people receiving care in a care home or the community will become infected. That guidance is still up on the website with a note saying it was only withdrawn on March the 13th and has been superseded. Since then, hundreds, of course, have been infected in care homes and hundreds have died.
There are more than 400,000 people living in care homes in the UK. 70% of them are likely to have some form of dementia. Many of them have other long-term conditions, which puts them at increased risk of how they will manage if they get the virus. They're at increased vulnerability, and unfortunately, they just weren't considered, I think, well enough, early enough on, and that leaves us with this situation now where care homes have effectively become like incubators for the virus.
We asked why Public Health England had advised the danger of infection for care home residents was very unlikely. They've not yet come back to us. But is this U-turn on care home testing enough? Yesterday, the owner of this Devon home was demanding just what the government announced today. So is he convinced?
What we've now got to see is that they put their money where their mouth is.
Delivery.
Delivery is the most important part of this.
In Scotland, more devastating figures on care home deaths. They amount to around a quarter of those dying from the virus.
This shouldn't need said, but I want to say it, that the residents of care homes matter every bit as much to us as people in the community or in hospital. It is just as important in care homes as it is anywhere else. In fact, I would say it is more important.
The UK government strenuously denies it's neglected the care home sector, that the lives of residents here don't matter. But this is an NHS document which has disappeared from the NHS England website. On page 2, this document states the following patients should not be taken to hospital unless authorised by a senior colleague, and it lists 5 categories, including care home residents or community hospital patients until discussed with a clinical advisor, any patient whose care can be provided in a community setting, any patient whose advanced wishes state they do not wish to receive resuscitation, any patient with dementia who following a head injury or fall is functionally unchanged.
We have been told that people have been told that their residents wouldn't be admitted to hospital. So I think clearly that guidance in some form was out there, and that was incredibly worrying to us. You know, as I say, somebody should not have a decision made on whether or not they are appropriate for treatment by virtue of dementia alone.
NHS England said this guidance was changed after 4 days and decisions on hospitalisation from care homes are made with clinicians and families in the usual way.
And later in the programme, I'll be talking to one carer who's concerned she might be spreading the disease between vulnerable patients as she moves from one house to another.
Sir Keir Starmer, the leader of the Labour Party, has called on the government to be open about its plans to ease the lockdown. He says he's willing to give opposition support to the plan, but that it needs to be communicated in an open fashion to gain public trust. Sir Keir sat down with me just before the programme, and I started by asking him about the pregnant nurse, Mary Agyeiwaa Agyapong, who died.
This is just such a tragic case. It's almost impossible to find words. It's a real reminder that as we look at the numbers every day of those that have passed away, we have to remember there are, families absolutely shaken to the foundation by the loss. And that's particularly felt, I think, by those that are on the front line, those that are keeping the country going in the health sector, the care sector, etc. But this is just such a tragic case. If
you were running the government, more broadly on the coronavirus crisis, what would you be doing differently?
Well, I think the thing that is clear to me is that the lockdown is going to continue. And actually, we support the government in that, because the government is trying to ensure that we reduce the number of cases of coronavirus and reduce the tragic number of deaths. What I've called for today is for the government to think about the next stage, which is how do we exit from lockdown in due course? I'm not asking for particular dates. I know that's not realistic, but we need to know what the strategy is for the next stage. We need that for two reasons. I think that we've asked a lot of the public in the last few weeks. They've given a lot. And thank you to everybody who has stayed at home and followed that guidance. We're going to ask them for more. But we need to have their trust, and we can only have that if we're open about what is likely to happen afterwards. I also think that mistakes have been made in the past about not planning clearly enough and quickly enough. And if we're to have an exit strategy from lockdown, then the planning needs to be put in now.
So I know you don't have access to the scientific advice that the government's seeing right now, but you've got the sort of broad principles. You've been watching what's going on. So would you say relax the lockdown on schools first, or shops with social distancing in place? Where would you go?
Well, I think that is part of the discussion we need to have. One of my concerns is that the longer schools are closed, the bigger the inequality gap between children that are being homeschooled with parents or a setup that is very supportive of that, and children that aren't, perhaps in very overcrowded accommodation without the ability to have that sort of homeschooling. And the longer that goes on, the bigger the gap will be. That's why the principles here are important.
So schools would be your first priority?
I would want to discuss that with the government. I think they're very important, and I think that's exactly the sort of political consideration that needs to be taken into account.
Obviously, the impetus for exiting lockdown is, once the public health crisis is over, is economic. And we saw these terrible figures yesterday, terrible projections of what might happen to the economy because of lockdown. Unemployment at its peak would be higher than it was during the peak of the Thatcher years. You were a young man during Margaret Thatcher's government. What do you think the impact of that scale of unemployment might be?
Well, it would have a huge impact across the country. And like everybody else, I saw those figures yesterday and received them with dismay, because the damage to our economy and the impact that will have on real lives is going to be profound. What we have to do as politicians is make the argument for a different and better future. What we can't do here, now we see so clearly who the key workers are. We can't go out on a Thursday and clap at 8 o'clock, a very emotional moment across the country, and then say when we're through this, it's back to business as usual. There is going to have to be a different way of thinking about our economy. We can't go in for another decade of austerity, and we've got to reevaluate people. The people on the front line that we clap are undervalued and underpaid, and they have been for years. And at the end of this, they deserve a better future, and the country deserves a better future. And it's for us politicians to set out what that can look like.
Very briefly, given that the scale of the crisis that we're currently in the midst of, do you really think you could have done any better in government?
Well, look, any government would struggle with a crisis like this, a global crisis like this. And I don't think it's helpful for me to pretend that any other government would have got it completely right. I do think the government was too slow in the first place. I do think they got off to on the wrong footing. And I think that the provision of equipment to the front line hasn't been quick enough.
Do you think that government errors have cost lives in this crisis?
I think that is a question, it's a searching question which is going to have to be answered. I think the public at the moment want to hear me as the leader of the opposition and the Labour Party saying we're putting our shoulder to the wheel to support the government in what it's trying to do now, which is to reduce the number of deaths and reduce the number of cases. And that's what we're doing.
So, Keir Starmer, thank you very much.